system, and others. So that has been definitely a bright spot in some really challenging times. With that being said, we have been very fortunate at MDHHS to have contracted with an organization called HONU that has been spearheading statewide testing for COVID-19 and has been doing quite a bit of testing in our shelters over the last couple of months. All of the shelters who have been working collaboratively with HONU and LTS, their subcontractor, to have testing events at on-site, in many cases weekly or bi-weekly, in some cases monthly in your facilities. It has been a wonderful partnership, and the response has been very, very positive. Being able to test on site in our shelters has been a real positive experience, and they have been able to deploy testing teams very quickly to many sites across the state. The results are coming back relatively quickly, which is great, and the best news of all is that thanks to all of the work that all of you have done, our entire provider community, our local health departments, our hospital systems, FQHCs, the number of positive cases that have occurred in our shelters, in our homeless community, has remained relatively low, which we're really grateful for. And I really have to say that that is a true testament to all of the work that our providers have done, whether that be the work that you've done to create distancing in your facilities, decongregating your facilities, innovative and different ways of disinfection and sanitation practices that you've been doing in your facilities, changing the way that you serve meals. So many things that have been put in place that I truly believe have had a substantial impact on keeping the number of cases, COVID cases in our communities low. So thank you so much. Keep up the phenomenal work. We do continue to gather data. Our team with the Salvation Army, our regional managers, if you're an ESP program, are continuing on a weekly basis that if you're not doing testing with HONU right now, but are doing testing either with your local public health department or a local pharmacy or a hospital system, we're continuing to ask weekly what the status is of your cases, and if you've had any new COVID cases or if you've had any more testing. And the reason we do that is because we are the only mechanism for being able to track shelter-specific cases in the state. It's currently not, there isn't an indicator or something within the databases through the health departments that are able to sort of flag that a case is in a shelter. So we just really appreciate all the work that all of you are doing. We know it's sometimes a pain to get one asking for more information, but that data is incredibly valuable and has really been able to help us at the state level to be able to guide policy and information, particularly back to my colleagues in public health on the impact of COVID specifically on our homeless population. So thank you very much. Next. So we want to talk about planning for positive cases. Obviously, in the current environment that we have, cases, the number of cases of COVID are going up sharply just recently in the last several weeks. There's always the potential that we will have positive cases in shelters. So we want to reiterate some of the things that some shelters have been doing, and to just say these these tend to be examples of best practices or things that are seem to be really effective when it comes to keeping cases low, or if you have positive cases, how to react to them. The first one is shelter diversion. Actually, that was a fantastic part of the conversation earlier this morning, was about if there were ever a good time to do diversion, now would be a great one. Helping people stay, locate and stay in places that are safe and more stable than a shelter is an ideal situation, because the best place to be in a pandemic is in a home, obviously. So we really encourage you to implement shelter diversion techniques. Many communities have already had these in place before COVID and are ramping them up even more. Others are putting them in place right now, and we're really encouraging everyone to really try to do shelter diversion in a meaningful way to help individuals and families to be able to find a safe place to stay as an alternative to shelter during this time. The second is encouraging stable placement. One of the things that we had done earlier in the COVID pandemic was to, we relieved the 90-day rule for the emergency shelter program, and it was really about encouraging stable placement. We do know that from what we've been able to tell from the data, that placements are taking longer in shelters, but there is kind of a little bright spot, which is at the end of those placements, people are going to a positive housing destination. So right now, the best thing to do is to keep to help people stay in a stable placement. If that means staying past 90 days, well, that's what needs to be done. And then helping them get into a permanent and stable housing situation from the shelter is really important during this time. Isolation and quarantine, have a place, have a plan. Many communities that were particularly hard hit by COVID in the spring and early summer did some pretty amazing efforts in standing up isolation and quarantine facilities, whether that be non-congregate sheltering in hotels and motels or in congregate settings in nursing homes, in school gymnasiums, in rec centers for people who were COVID positive and needed to quarantine, or people who were COVID exposed and needed to isolate. The best thing that we can say at this time, because the number of cases are increasing, is, and because the weather is getting colder, to have a place and have a plan. Continue to work with your local health departments, continue to work with your local governments. Things might change, obviously, in the fall, and maybe non-congregate sheltering and moteling just isn't going to be a viable option. So there are other possibilities out there. If you want to talk more about them, if you want to talk through those best practices, please reach out to us. We're happy to either connect you with other communities that have done isolation and quarantine in a couple of different models and in different ways, so that you can share some peer-to-peer ideas. And we're more than happy to talk through it as well. So disinfection and sanitation, we are putting together some information that we can share with everyone based on some very interesting and innovative techniques that have been used by shelters throughout Michigan. Something called biofog. Essentially, it is a way of a sanitation and as a method for disinfecting an environment. A safe and easy and relatively low cost but effective way of being able to disinfect and sanitize environments. So we're putting that together, and we'll be releasing that here shortly for hopefully to help as we get again into those colder months. And then finally, PPE. Early on, obviously, PPE was something that was very difficult to get a hold of. Thanks to some really amazing work on the parts of our partners in different communities, our community action agencies who have been phenomenal in standing up our distribution hubs for PPE across the state. Some of our colleagues who were able to actually facilitate some donations of large donations of PPE, and then actually drive them to our hub sites. We're really grateful for the work that was done to get PPE into the hands of our shelters and our other providers. At this point, even though PPE is available, we also know that you can never have enough. There, not anticipating what might be coming. Always good to have as much as you can. So if you are having problems obtaining PPE, please reach out to us. Let's see if there's anything that we can do to help you get in touch with either other providers, other programs, anything that we can do to help see if we can get you in touch with what you need. And it wouldn't be fall without talking about flu vaccines. You've hopefully seen there's been a lot of conversation about getting flu vaccines for individuals in this fall so that it can help individuals from getting the flu or hopefully not getting a double whammy of getting the flu and exposed to COVID. Local health departments and FQHCs have received flu vaccine allocations across the state. They are doing vaccine events as their time allows and their resources allow. If you are interested in a flu vaccine clinic, and you cannot, you're not able to get one locally, please reach out to us so that we can work with you and work with some other providers to see if there's a mechanism for getting a testing event, or I'm sorry, a vaccine event set up in your shelter. Now is the perfect time. It's almost the end of October, and flu season is going to be coming very, very soon. So please reach out to us if there's anything that we can do to help. And some folks have asked about COVID vaccines and what happens when the COVID vaccine is available. And I don't really have a lot of information at this particular time other than the department is working hard to figure out ahead of time what would be the best distribution plan and strategy for getting those vaccines out. And our homeless population is a priority population as staff and homeless individuals. So we will keep you posted on that and know that our department is hard at work. The last thing I wanted to talk about a little bit today is winter sheltering as the weather gets colder. We are concerned about what this winter might bring, whether that is reduced capacity because of social distancing and decongregating of shelters, whether that's a reduced capacity locally because volunteer-based shelters are not able to open. We are keeping an eye, a very close eye on the what locally your capacity needs are. If you are running into situations where you're finding your capacity is going to be strapped for the winter months, we do ask that you reach out to us to see if, and hopefully there might be some things that we can do to help brainstorm some ideas, some alternative ways that you might be able to still maintain some capacity. At the same time, we released preliminary guidance a few weeks ago for responding to cold weather and COVID. And this week, HUD actually just released some tools and some planning guides on winter sheltering, which we are going to also released to our network. It really is the best time to plan now with your local government, your health department, and emergency management about the potential need for different sheltering availability for cold weather. One of the things that we're also in the process of doing is putting out a communication specifically to local governments, health departments, and emergency managers, explaining the situation, explaining that capacity could be affected in in communities across Michigan, and how they can reach out to their local COCs, local planning bodies, and shelter providers to start planning for those winter months, and coming up with strategies and plans for alternative sites. All right, and with that, I am going to turn this over to Shane Buys, my colleague from Oakland County.
All right, appreciate that, Lynn. And just to confirm, Lynn, will you be clicking the slides for me?
I sure will.
All right, fantastic. So Janine said earlier that currently I'm the administrator of our some of our nursing services here at Oakland County, and I'm moving into a different role in a different division, Community Home Improvement Division. However, prior to both of those things, for about 11 years with the county, I was one of our epidemiologists. And, prior to, March, that didn't mean a whole lot to very many people. But since then, that's become a whole lot more interesting of a conversational topic. And so I also have that background in me, and I've actually been having to put that hat back on since March. And so that's been an interesting journey. But I'm here to talk about public health as it relates a little bit more in detail. So just again, kind of some local public health impacts. This is, I think, a lot of what people think public health does. We monitor safe drinking water, sewage, which includes, septic tanks, and, environmental health might go out and make sure those are being properly maintained. We investigate restaurants and we inspect them, and we make sure the food is being served incorrectly. We give vaccines. Most health departments have received some funding for kind of family planning type services. We do various screening programs. Some local health departments help out with cancer screening and even screening programs. And they all have some aspect of emergency preparedness. And, as we all know now, we do outbreak investigations. But Lynn, if you just click the button once, public health lately does so much more. And this is the transition from public health 2.0 to public health 3.0 that you'll hear me talk about a little bit more broadly, that public health isn't just about so much of these programs as we're really looking to be a community convener and really be a connector and work with so many different units across the community. So where does public health get some of its authority? And some of these next few slides are going to have a few legal things. I'll try not to get into the weeds too much, but I just want you to know kind of where some of public health's power and authority comes from. It basically stems from, in Michigan, the Public Health Code of 1978, which is a really well-written law, and it was purposefully written in a very flexible way because back in 1978, they recognized that 50 years from now, they did not know what could possibly happen. And so that is where local health officers, the state health department, that's where they get all their power from. As an example, workplace smoking and the the secondhand smoking here in Michigan. In Charlevoix, it all started where the local health officer and the local health department said you can't smoke in restaurants before it became a statewide thing. And that was because they went and showed that this is a health issue for those workers. And they cited the Michigan Public Health Code as their authority to do so locally. And so that's just one example of where public health gets its authority to do certain public health interventions. Next slide. So initially, all the mask requirements and all the orders coming down from the state, that I think many of us up until recently were familiar with those. And those were coming from the governor's office, and those were coming from different laws on the books. And there was some challenge to that, and the Michigan Supreme Court ruled against the governor's office for using those laws to issue those kinds of requirements. And again, the Michigan Supreme Court didn't say that the content of those orders were at issue, but it was from where the governor was getting her authority to do so. And so they said, okay, fine. Then they went to MDHHS, and MDHHS began to issue very similar orders, citing the public health code. And so that's where very similar orders are coming from the state, but they're coming from a different law being utilized. Next slide. As an example of using the public health code, there's any number of what's described as imminent dangers out there that either a local public health department or the state health department, if they provide evidence, they can issue various imminent danger orders to get people, businesses, institutions to either do something or stop doing something. And I picked an example that I found popped up all the way back from 1923. The Michigan Supreme Court has upheld this kind of authority of local health departments. Back in 1923, there was an example where there was a disease outbreak going on in a school, and the local health department says, you know, we need to close down the school to stop this outbreak. And the local school board says, no, we don't want to. And the Michigan Supreme Court ruled against the school board and said, no, that the local health department has broad general authority that as long as they supply the evidence and as long as that evidence is good evidence, they can issue these orders to protect the public's health from imminent dangers. Next slide. So how does this relate to COVID-19? Well, you can imagine if somebody is infectious with COVID-19 and they are, and this is kind of a important word here, knowingly exposing others, or maybe they've been exposed to COVID-19 and they're not quarantined like they are supposed to. If a local health department thought it was a big enough deal, they could, for that particular person, issue a health threat to others and start the process with a court to get that person to either isolate or quarantine upon, penalty of potentially incarceration. Now, in reality, does this happen for COVID-19? In reality, it doesn't, because there's just so much COVID-19, unfortunately, out there in the community. However, this has happened for other diseases. For example, like tuberculosis. Very often people with active TB, they're not necessarily convinced that they have active TB, tuberculosis, and that they're infectious to others, despite all the medical evidence to the contrary. And sometimes local health departments have to start to go down the road of issuing a court order to get people to either start taking their tuberculosis medicine or at least stay home and away from others to keep them from exposing others with tuberculosis. Now, the bar to do this is high, and that's rightfully so. Government shouldn't just be able to take away somebody's rights and freedoms frivolously. But if there is the evidence and if there is an imminent danger to the public health, local health departments could go down this road. But again, in reality, does that happen very often? Honestly, it doesn't. Usually issuing a letter and basically saying, hey, listen, we have the right to do this, that usually has enough authority behind it to convince people to say, I better listen up. I better maybe change my behavior. And I actually worked with Elizabeth and, our health officer, Leanne Stafford here in Oakland County. There was one particular person experiencing homelessness that we were starting to go down this road, and knowing that it was a high bar, we kind of started the process, but really we were able to get that person in a different mechanism, hospitalized and into a hospital during their infectious period, so that they weren't exposing anybody anymore. So usually although it's on the table, it's not a mechanism that's used very often, because there are some bars to jump over to like go all the way with this particular case. So next slide. Very often though, what you are going to experience when working with a health division as it relates to COVID-19, all health departments, they're going to be doing case investigations. So that means maybe you have a resident in your shelter, or maybe they're not a resident in your shelter, but you know they're experiencing homelessness and you know they're positive for COVID-19. Local health departments want to do case investigations on those individuals. And what is a case investigation? When did you start getting sick? Who have you been around? And asking all those kinds of questions. And so health departments, if they haven't yet, they might reach out to you if they know the person's experiencing homelessness and they know that they either come to you for services or reside in one of your shelters. And very often I've been parts of tabletop exercises over the last 20 years of my career, whether it's with fire departments, police departments, or other entities. And we always get to contact tracing. And very often everyone's like, how are we going to do contact tracing? How are we, the police departments and other entities think that they have to be the ones to do contact tracing. And that is a role that most health departments have a lot of experience in. And they might come to you and ask you like, hey, do you know who this person who's sick with COVID-19 might have been around? They might ask you for some input and help. But that is, one of their central roles during an outbreak investigations that they do. And so if you know, or if you wind up with a positive COVID-19 case in your shelter, or one of your clients that maybe they're not in shelter, but they see you for services, is positive COVID-19, and you're like, how are we going to find out who this person was all around, or how are we going to do that? You don't have to do it alone. You can do it in conjunction with your local health department. Various local health departments have a range of services, but some, and many do, might have might be able to offer various environmental mitigation guidance. Here in Oakland County, some of our environmental health sanitarians have industrial hygienist backgrounds. And so what they are good at doing is they're good at looking at workplace threats, whether that is in this case an infectious disease, and kind of interpreting various guidance from the CDC and helping you implement that into your particular specific local jurisdiction or your local setting. Your own building. And that's something that you just have to reach out to your local health department and like maybe know the lingo to say, yeah, hey, do you have anybody with an industrial hygienist background that might be really well suited to kind of help us out with, where do we put this plexiglass, or, where do we set up these barriers, or things along those lines. And also, most health departments are wanting to move towards this being this community convener, going from public health 2.0 to 3.0. Part of that is being a resource connector. I used to work at Kmart. I used to be a Red Vester, and I worked in sporting goods. And maybe somebody from women's apparel would walk over and say, excuse me, can you help me? And I might say, no, I have no idea. I can't help you with that, but I know who can. And I would get them in touch with a person who could assist them. Local health departments, a lot of them, they like to, and they work purposefully to kind of fill that kind of a role to connect different community entities to support each other. And then Lynn touched on it earlier, vaccinations, whether it's flu vaccinations or with any luck, the upcoming COVID-19 vaccination efforts. You want to start to have those conversations with your local health department now, and those planning and get in the planning phases if you haven't yet. This is the time to start that conversation so that when it comes out now, even if that local health department isn't yet ready to start talking about it, reach out to them and say, hey, when the time comes, reach out to me. This is who here at our shelter, who in our services you want to connect with about future vaccination efforts. And as Lynn said, if you don't have access already to flu vaccine for your residents, talking to your local health department about flu vaccine availability, is that something that is a great, for lack of a better term, dry run for future COVID-19 vaccine efforts. Okay, next slide, Lynn. So one thing I will say is, from personal experience, local health department systems are stressed. That's just the reality of it. Local health departments are trying to coordinate with all the things that you see listed on here about COVID-19 prevention and mitigation efforts. Schools obviously is a big one, back to the fall. Businesses want to reopen safely. Municipalities, they are trying to, like at the county level, they try to coordinate with all the different cities, villages, and townships at those municipality levels. The public calls, and they just have their own very specific concerns to COVID-19. And how do you communicate that to everybody? Healthcare providers, testing, is this a good test? Is that not a good test? This person tested positive, but then they test negative, and they test positive again. What do we do? And then there's any number of mandated services that health departments, maybe they don't have to provide them at the same level that they were providing them at before, but we still have to provide them. As an example, we're still doing sexually transmitted disease testing and screening. We're still giving regular vaccines here at Oakland County. Another one is immunization waivers. Parents who request to not get their kids vaccinated for back to school efforts have to first come to a health department and have a conversation before they can send their unvaccinated child to school. And we still got to do that. And so we're trying to do all this additional COVID-19 follow-up and response effort while still trying to do some of those mandated services. So I just give you that background to let you know that if you're reaching out to your local health department and perhaps they're not being as responsive as you want them to be patient, continue to reach out to them. They want to help you, and we're trying to help as many people and entities in the community as we possibly can. So next slide. So how do you go about engaging, with a stress system, with a local health department that has 50,000 things on their plate? Understand our priorities and our motivations. And if you already have relationships with the health departments, lean on them. And maybe it's that relationship that you think isn't really relevant to COVID-19, but it's still a relationship. For example, if you serve food in your shelter, I'm sure you have to have a visit from from your local health department. You probably have that relationship with that environmental health sanitarian or that sector of that health department. You can reach out to them and say, hey, who would I talk to? Or, hey, Joe, nice seeing you, the other day, checking over our food serving. This is what we need. Is there anybody that you can get us in touch with that can help us? And usually those kinds of pre-existing relationships, even if it's not specifically related to COVID-19, you're going to get a whole lot better of a response from your local health department rather than just cold calling the main number if you already have that relationship. And then also reach out to them, let them know that you can kind of help fill maybe a program requirement. I know in our immunization action program, part of our outreach plan is providing vaccines to hard to reach populations, such as people experiencing homelessness. Your local health department might have a very similar requirement to provide outreach vaccines or other outreach type services to hard to reach populations. And you can be that conduit for that local health department for them to reach out to reach population of people experiencing homelessness. And finally, you've probably heard me say it a few times, Public Health 2.0 and Public Health 3.0. And really what that is that's kind of a national accreditation standard. And we also have state accreditation standards. You don't need to know, the difference between the two or anything like that. just know that in our accreditations, in both the state accreditation and the national accreditation, there is a component to working with community providers. We have to show evidence that we are working with and regularly engaging with any number of community service entities. And sometimes that's being part of a focus group, sometimes that's being part of a regular ongoing community outreach committee. If you're not already part of an effort like that, or if you don't already have some kind of regular partnership with your local health department, when you call them up and you say, hey, can you help us out with COVID-19? By the way, I hear that you have these kinds of accreditation requirements, so you got to be engaged with the community. We'd love to be a regular partner and help fulfill some of those requirements. That might help kind of get that relationship off the ground if you don't have one already. And also understand the structure of the health department and your background, your health officers and leaders. And the reality is that across the state of Michigan, most health departments, the majority of their services in the background of their health officers are environmental health related. They provide environmental health services, inspecting restaurants, inspecting septic tanks, and things along those lines. And so most of your engagement and most of what the services and backgrounds are going to be from an environmental health point of view. And so you might want to just kind of speak that language and kind of recognize that if they're not really into the community engagement, it might be because they're not used to it. They come from more of a regulatory background. And I would be amiss if I didn't say, reach out even when you don't have to. If you're like, oh, I'm doing good right now, strike up that conversation, form that connection, form that relationship, have lunch whenever you can or something if there's an opportunity to, with your local health officer or somebody from, maybe virtual lunch, of course. But just start to form that relationship. And if they don't have time for you, ask again, ask later. They want to help. It's just a matter of trying to prioritize that assistance. So I think that might be my last slide. Lynn, can you click forward? Yep. So right now, I really appreciate everybody's time. And again, I was just scratching the surface of local health departments and a lot of our services. And right now I'm going to turn over to Elizabeth Kelly.
Thanks, Shane. I really appreciate it. And I have to say, we really appreciate our relationship with Oakland County Health Division. They have just been absolutely wonderful in supporting us through some things that are have been slightly challenging over the last couple of months. Next slide, please. Planning for the great unknown. Now, it says here, Watson, I don't think you appreciate the gravity of the situation, but I've actually felt like that, and it wasn't because I didn't appreciate the gravity of the situation. I think I was a little overwhelmed by it. Next slide, please. So today we're going to talk about areas of preparation, and this is not meant to be a comprehensive list, but rather the kinds of ways that you may want to consider to be able to cover all the different aspects. So everything from administrative, programmatic, HR services for the service recipients, process changes, because those things have happened as a result of this, how you deal with COVID positive guests, using alternative sites like motels, gymnasiums, and things like that, and the new tools that we're developing, as well as our collaborative partnerships. So most of us have an emergency plan, and it's something that is a really important part. But I can tell you in our emergency plan, we talk about things like what happens if there's a problem with the building, no heat, the building catches on fire, etc. How do we continue to operate? But pandemic was not actually a part of what we ever considered, because it seemed like, at least to our planning, it was something that happened somewhere else, but didn't really touch us. So this is all very new for us. So I have things internal and external that we're going to talk about a little bit further on. So let's move on to the next slide, and we're going to get into more specifics. So in the program part of this, when you are working with your program, you're going to have to work with a couple of things. So things like reducing your capacity, making sure that hand hygiene and shelter hygiene has been stepped up. I mean, it's stuff you already do, but now you have to do it on steroids. And adding things like temperature logs and how you serve the food. Do you do it as individual box servings? What is the safest way to be able to do it? And of course, the masks and social distancing. And I can tell you that just like everywhere else, masks are not very popular in the shelter, but they understand, just as we all do, that it's sort of the necessary thing that you have to do. And PPE, quarantine, isolation space, all of these things are part of it. So let's move on to the next slide, and we're going to talk about the staff, because a lot of our focus has been on how do we serve people better. But I wanted to make sure that I called this out because it's really important to pay attention to the staff, to sort of take their emotional temperature and find out how they're doing, especially in the dark days of the spring when this all first came down. I had a lot of staff who came to me with concerns. They would say things like, I take care of my elderly parent. I don't know whether this is a good place for me to be working right now. I have small children, etc. So there were all kinds of concerns. And so what we did was we tried our best to be able to address them. So communication, and we did things like we had some churches that donated gift cards specifically for the staff. So communication went out as email communication. Now I'm going to say shelter staff don't seem to be really great at reading their email. And especially if you have a lot of part-time staffers, often they're reading their email maybe 4 or 5 days after you've sent it because that's their next shift. So what we did was we embedded in the body of the email and told them that we were going to do it, that I had 3 gift cards to give away. And so the people who emailed me with the secret word, which would be embedded in the email, in the body of the email, would get a gift card if you were the 5th one, the 10th one, and the 22nd one, for the 22nd person to do that. Then we would give them a gift card. So it kind of broke up the monotony. It added a little fun to something that was really, really heavy. And so the other thing too is we made sure that we were looking to see what we were going to do to be able to protect people. I had a staff person whose mother is 94 years old and was in a nursing home, but she used to go over and visit her, and that was before the prohibition against going into the nursing homes had happened. And she wasn't sure what she could do. And we actually assigned her to the motel site, even though that was a quarantine area, because she would don full PPE and did not come anywhere near the guests. Everything was done with them looking through the window on a telephone, and they had windows that they could see each other, and she would stand outside and talk with them. So we tried to figure out ways that we could get around that. The other thing too that I would urge you is please don't, please make sure that you have the right PPE. And make sure that people are using them. Insist that they're wearing the masks and gloves, socially distancing. But if you have shields and if there's anybody who you're encountering that you're not quite sure about, they should really put that on. And you want to make sure people are trained, because this is something that is really important. The more tools you can give people, the more comfortable they're going to be with the job. Don't minimize their fears. And so we actually bought a cell phone plan, and we added laptops that we were able to get through a faith community, actually, that provided some grants, some COVID grants, so that we could increase the distance between the case managers and the guests, so they weren't sitting in a cramped little office, about 2.5 feet from each other with only a desk in between. And so we were able to do that. And the guests actually liked that because it sort of gave them the ability to learn how to do and to practice teleconferencing, which they were now beginning to use for meetings with their doctors or with their mental health case managers. Another thing that really helped was accessibility to COVID tests and flu shots. Those are things that if you have a COVID outbreak or a flu outbreak in a shelter that can be really devastating. And so anything that we can do to be able to help that, help keep that under control, and help keep that top of mind for people is great. And every time, so we get tested every 2 weeks. Oakland County Health Division provides a nurse. They provide the test kits in the labs, and then their staffing is augmented by medical students from Oakland University, William Beaumont School of Medicine. We rewarded staff. We did hazard pay during the lockdown. And so we made sure that we also had a plan in place for anybody who was overwhelmed to be able to talk to a mental health professional. And then the other thing is just you want to make sure that you develop plans for staff absenteeism, because that will happen. You don't want somebody coming to work if you don't know what's going on. Next slide, please. So reducing anxiety among guests, again, it's very similar to what you're doing with the staff. You have to be accessible. You have to listen to their concerns, but make sure that you are also making them part of the solution, providing hand washing lessons and helping them, having them help assist with shelter cleaning, talking to them about what you're doing to keep them safe, because they may not recognize that because not every bed is occupied, that you're reducing capacity in a congregate setting, for example, and helping them understand that this is something that we're going to be doing together, and all of us are trying to do our best to keep everyone safe. Next slide, please. So triaging new clients is also a bit challenging, you know. So we don't have a good space inside, so we do our triage outside. If we don't know somebody's status, if they're coming from an area where we feel they may have been exposed, or if they're coming from a hospital, we actually will directly send them to the motel, which is what we use for people whose status is unclear to us until we can get a COVID test. And when our staff is interfacing with them, they are also dressed in PPE. We're providing the guests with a mask. And in the shelter, everybody has a whole collection of masks right now. We've had a lot of people sewing and providing that for us. If there's questions, like if we know that somebody is coughing a lot, or if they've come from the hospital and it says that they do have COVID, we may hand them a telephone instead and do the phone intake, or do the intake via phone a little more remotely. And so we're going to make sure that that we're doing that. If somebody is coming directly into the shelter, we're pretty confident about their status. We're still going to ask that guest to shower and change their clothing, and we're going to make sure we wash the clothing for them. Next slide, please. So new tools in our agency toolkit. So a lot of things have happened. So we've been able to acquire, as I said, more laptops and smartphones, but now we have Zoom and Google Meet, Google Teams, and all of those things. So this is a whole different animal from what we were dealing with last year. I don't think anybody really had a clue anything about the principle of social distancing, but floor markers now dot our shelter. We have capacity signs throughout. There are physical barriers that are up in areas where we didn't have that before, and we remind people all the time about that. We've had guest trainers that come that are medical students and nursing students. We actually have not allowed any volunteers in the shelter with the exception of medical volunteers, but they do things like teach about proper hand washing, why it's important to get a flu shot, how to protect yourself against COVID. And so we do a lot of different teaching that way as part of our everyday routine with shelter guests. And the shelter guests are actually inside a whole lot more, or they're on the property. We actually have talked with them, and they've agreed to not have as much outside time external to the grounds of the shelter. So they're not just walking down to the store just for the heck of walking down to the store, but they might take a walk around the neighborhood because that is going to be safer than going into an enclosed space. So we try to make people aware And then we develop new partnerships. As Shane said, some of you may not have had a relationship with your health department, but that's something that's really critical to this. But there's also a lot of other agencies too to know about, which moves us on to collaboration in the next slide. So what do you need to know from about community partners? So you can get things like expert advice, healthcare support. So our local FQHC is another one that we've developed relationships with over the years, and they provide telehealth, and they can provide that in real time. Our mental health providers were working remotely. And so again, mental health appointments with case managers, psychiatrists, etc., were also in via telehealth. So we developed areas where people could go with the computer or the phone, the smartphone, and have a face-to-face meeting there. PPE and cleaning supplies, that was something that we've also gotten through community partners. Your emergency management area, for example, in your county may have some of those things, especially in the very beginning when everybody was scrambling. They were able to provide us with enough to get by until we were able to get some more. Food, our county actually has decided with some of their CARES money to provide food to the 2 shelters that are in the county, which is Hope and Lighthouse. And so those 2 shelters, we get box food. Right now they're coming from Meals on Wheels. And so our staff have minimal ability to interact or touch with the food. We hand the person the completed box, and then they're able to use a microwave that is available to them and be able to microwave their food. And that has really helped as well. Things have changed. So we have identity documents, vital documents. Some of those things have slowed down, which has lengthened the time in the shelter if somebody needs a state ID or a social security card. A lot of those 2 agencies were working remotely in the spring, and some of them have been very backlogged. So that's another issue that we've started some calls with them that take place once a month with both Michigan Department of State, Social Security Administration, as well as the MDHHS vital records. So we're able to at least open the dialogue and let them know that these things are happening and we need to be able to have a quicker pathway. And so really what it leads to are those smooth transitions and the warm handoffs. And so the next slide, engaging community partners. And this is the first point I think is probably the most important. Be relentless. This is an emergency. If you're not getting a call back, call again. It's not because they don't want to help you. It's because they're as overwhelmed as you. But make sure that if this is something that you need to talk about, that you have questions about, something that you need, it is really important to be part of that. The COC can be a valuable part of that as well. There are planning meetings taking place within the counties, decision making, all of those things. Sign up for the local county government e-newsletters, get on their news feed when they release press releases. Those kinds of things are really helpful to giving you the ability to participate in this, and make sure that you identify what services or items that you need that you don't currently have. If you can't get in at a higher level, you might need a door opener, but chances are there is somebody in that agency who can introduce you to the person who has the ability to do that, to make that happen. And be realistic about your needs. Don't tell them you need 100,000 pairs of gloves when maybe that's a 5-year amount for you. Make sure that you're realistic, and they appreciate that as well. And other agencies that serve special populations that might intersect with the ones that you serve are also going to be important because, for example, mental health services are critical no matter what in a shelter, but mental health services are absolutely critical when it comes to the the services that when it comes to people who may be isolated if they're in a motel or are feeling overwhelmed by the pandemic. And then there's the landlords that you want to talk to make sure that they are still on board and keeping that dialogue open, and motel owners that might be there to help rent space. So we're not going to put all our eggs in one basket. And then the last slide is about funding during the pandemic. Sorry, I missed this one. During the pandemic, there are a lot of ways. It's not just ESG money that's coming through. If you have an existing, this one is really critical, existing relationships with a foundation, even if it's one where you had a grant with them 4 or 5 years ago and not currently, reach out to them and discuss your needs. Let them know, because foundations have really changed the way that they are providing their funding right now, and they really do have money that they've allocated for emergency. Watch out for specialty grants, because those things are released all of the time that they might be your usual grant sources, but they'll have some information about that. So be creative. If you read something, so one of the things that happened in Oakland County was we read that local restaurants at the beginning of the pandemic were really struggling. So I reached out to the county exec's office and I emailed him and I said, is it possible that you could use CARES money to contract with the restaurant so that you could serve 2 folks and then provide food for the shelter? And which he did do that. And it was something that actually was very successful. Then as the restaurants opened, it transitioned to another source. So sometimes if you have a creative way to match those kinds of things, it's really good. Watch your cash and make sure that you're asking for things that might be able to be donated, and use your e-newsletter, your media, and also make sure you maintain contact with your donor and volunteer base. Let them know your successes, let them know what you're doing, because it's really important to send them an email that says, I just wanted to let you know that everything is well here. All of our folks are healthy, and I hope you're doing the same. You don't even have to make the ask, but sometimes that's enough to help people understand the importance and to remind them that you're there. And virtual fundraising can be another way to convert your fundraising over. And while this is not about that, but it's just something to consider. There are all kinds of ways that you might be able to do it. The pajama party that I saw, that one was I thought was a very cool thing where people would participate from their homes, but it would be like a pajama party was the theme. So on the last slide is pace yourself. It feels like this is a very heavy lift. And so you want to make sure that you are practicing self-care, that you're helping your colleagues also to do that, and you're monitoring your staff or your colleagues for signs of illness or for burnout. And make sure that you maintain your own structure in your life. Take time to exercise. All of these things that you're like, yeah, I don't even have enough time to do that. But if you get yourself into a routine, you'll find that your stress level is more manageable. And the last couple of things are really important. Recognize what is and is not in your control, because there are a lot of things that we're dealing with that we really can't control. We don't know if the next person that comes to our door is going to be the one to infect everybody. So what we want to do is make sure we take as many precautions as possible and do the best that we can. And then the last thing is ask for help. Whatever it is that you need, if you don't have it, please ask, because this is the way to be able to utilize your resources well and to be able to get what you need so that you're going to be able to continue to function. And that's all that I have for now. So thank you so much.
Okay, so this is the time of the session where it's your opportunity to ask questions. I don't currently have any questions in the chat, so I don't know, and I know we've gone a little bit over time, so if you can be patient for just a few more minutes, we can give a couple of minutes to see if anybody has any questions for our presenters. If you'd like to type those into the chat box, please. And while you're doing that, I think on a note, it was a good way for Elizabeth to end. Soon after this session is closed, there will be what we're considering kind of an after conference opportunity, and that is a trauma yoga session. And for those of you who are thinking yoga, I don't want to get down on the floor right now, it's mostly in your chair. So it's a seated opportunity, but it is an opportunity to take care of yourself for half an hour if you choose to. Okay, I'm not seeing any questions. You guys must have done such a fantastic job that they don't have to ask about them. Okay, we'll leave this open, the screen open for a little bit longer. And so if you decide you want to type something in, if you think of it, we can make sure that we get those questions answered later. But I'd like to thank Lynn and Elizabeth and Shane for taking the time today to talk with us. I think that was great information. I talk to Lynn all the time, and I've been listening to Elizabeth, and I learned new stuff that we haven't talked about, and I thought it was a great session. So I think that's all I have to share. If you signed in at the beginning stating that you wanted CEUs, if you would please take the time to sign out with your name again and say signing out CEUs. That way we'll make sure that we get you what you need. So thank you all. Please remember to join us tomorrow starting at 9:30. Once you signed out, you can exit the session. I'm going to just keep this open a little bit longer so that people can sign out, but I will be closing this in just a few moments. Thank you, everybody.